Welcome back, everybody. We're here with Dr. Dennis Morris today. He is the Vice President and Chief Medical Officer at Lima Memorial. We're going to talk about COVID today. So good morning.
Good morning. How are you?
Good. So after nearly 2 years of battling the pandemic, can you give us an idea of the trends that we're seeing right now?
Well, unfortunately, the news is not real good. I'm sure you're aware that in the last month or so, we've had a significant surge with the Delta variant, and that has really impacted our hospital. 80% of the people coming in with COVID are not vaccinated, and Delta has really taken its toll. And then I think everyone's aware that now we have a new variant, Omicron, which has arrived in this country, and we anticipate that we'll start to see the effects of that here during the holidays.
Sorry to hear that. And how is the increase of COVID-19 impacting the hospital as well as the patients?
Well, currently, in the last 2 to 3 weeks, we've had record numbers of COVID admissions. And so that continues to put a significant strain on our staffing and being able to provide for the patients. It's backed up our ED to where we have significant wait times for people to be seen in the emergency department. And then a lot of those patients that need to be admitted are boarded in our emergency department until we can get rooms available up on the floors for them. And so all those things play into that, as well as we are a transfer facility for some of our outlying rural hospitals. And we are at or above capacity and unable to accept those transfers to help them out. And then finally, I would say our elective non-essential surgeries that would require a hospital admission after their surgery have had to be delayed and rescheduled.
And we all know that Christmas is on the horizon. What precautions should people be taking as we prepare to gather indoors and be around loved ones?
Well, this is an old theme, but vaccination is still our best line of defense. And unfortunately, in this area, we are only about 40% or slightly above vaccinated. And so that I cannot stress enough the importance of that. I don't know how many more people we need to see die and be incapacitated for lack of the vaccine. It's proven to be safe and effective, but we still have significant resistance in this area. Short of that, obviously the holiday gatherings are indoors because it's getting colder. And so large groups indoors is something to be avoided. We would still stress social distancing. If you're going to be in those groups, masking would be still a very good idea, especially for those that aren't vaccinated. Frequent hand washing. And then the other thing that may be slightly off topic, but to be sure you've had your flu vaccine because it's also flu season, and both COVID and flu are respiratory viruses.
If you are experiencing any symptoms, you guys say to call 877-doclmpc, correct?
That's correct, because then we can actually do a televisit, saving people coming from to the ED, which helps with the backlog there. Then appropriate testing can be ordered. That can be done as an outpatient. So for patients that have some symptoms but may not require, urgent medical care, doing it as an outpatient is the best way to accomplish that.
Okay, well, thank you so much, Dr. Morris, for this valuable information.
Thanks for having me, and happy holidays.
You too. We'll be right back.